Good afternoon, everybody, and welcome to this NCD Alliance webinar on Wednesday, the 17th of January. My name is Katie Dane. I'm the CEO of the NCD Alliance. This is our first webinar of 2018, and no doubt it's going to be a very, very busy year for global NCD advocacy and policy, obviously with the upcoming UN high-level meeting on NCDs that will be taking place this year. So if we go to the next slide. Today we have a range of speakers. We have Elena Matska from the NCD Alliance. We have Christina from NCD Alliance as well as Priya Knaisen. And we also have a guest speaker, Felicia Noor from the University of Miami, who will be talking us through the recent Lancet Palliative Care Commission report. Next slide, please. So in terms of the agenda for today, we'll start off with a brief look at the year ahead in terms of some of the key dates coming up during 2018. We're slightly switching the order, so then we'll move to Christina to talk through the recent Global NCD Alliance Forum that took place in Sharjah at the end of last year. We'll then move on to preparations for the third UN high-level meeting on NCDs in New York, which will be a presentation from Priya Knaisen. Then we will move to preparations for the Executive Board from Elena Matska in Geneva. And then we will have our guest speaker, Felicia Noor, talk to us about the Lancet Palliative Care Commission report that was published at the end of last year. So if we move on to the next slide, just a brief overview for you at the beginning of this webinar on what's to be expected and what are the main events that are going to be coming up over the course of the year. Next slide, please. So 2018 in a nutshell in terms of the big policy forums and events over the year. In January, we start off obviously with the WHO Executive Board taking place in Geneva just next week, and that will obviously be one of the main focuses of our webinar today to talk you through the NCD relevant agenda items and policy papers that will be discussed there. During that same week, we'll also have the World Economic Forum's annual meeting of Davos, where there is a focus on NCDs that we're very pleased to see. Also in January, what we're expecting for the high-level meeting, and Priya will go into a lot more detail on this later in the webinar, but January is the month when we're going to begin to see the modalities resolution process beginning in New York, which will set the date, the length of the meeting, the level of participation, the outcome. All of those details will be determined in the modalities resolution, and things are beginning to really heat up already in New York on that. February, there will be the World Urban Forum, which is taking place in Kuala Lumpur on the 7th to the 13th of February. In March, many of you on this webinar are involved in the World Conference on Tobacco or Health, which is happening in Cape Town in South Africa on the 7th to the 9th of March. Also in March is the annual Commission on the Status of Women, which will be taking place between 12th and 23rd of March. In April, there will be the Global NCD Financing Conference, which will be co-hosted by the Government of Denmark and the World Health Organization on the 9th to 11th of April in Copenhagen. And the NCD Alliance has obviously been quite involved in building the support for that conference. In May, we move into the usual World Health Assembly time frame of the 21st to the 26th of May. That one will be very important in terms of advocacy for the high-level meeting, as well as a number of other NCD policy items that will be going through the EB, which Elena will be updating everybody on. In addition, in May, as you'll be aware, the WHO High-Level Independent Commission on NCDs will issue their report. That's the commission that's being co-hosted by Dr. Sanja Nista and Tabaré Vasquez from Uruguay. And that report is anticipated to be really trying to set the bar high in terms of ambitious recommendations for the UN high-level meeting. In June, what we're expecting, and some of these dates are pending confirmation of a UN high-level meeting on NCDs to be taking place in September. But assuming it is in September, then we're expecting there to be a UN Civil Society hearing on NCDs in New York. as is per the usual practice of having a civil society hearing before we actually get to the formal meeting in September, as an opportunity for civil society to be sharing perspectives and concerns and priorities for the high-level meeting negotiations. July, every year we obviously have the UN High-Level Political Forum for Sustainable Development. Dates for that one for this year are the 9th to the 18th. And this year the big focus for the High-Level Political Forum are many of the Sustainable Development Goals related to the environment, which provides great opportunity from an advocacy perspective for us to be linking NCDs to the environment. 26th to 29th is the Alzheimer's Disease International's annual conference, and then we move into August where the WHO Regional Committee meetings begin, and these will be spanning between August and October. And again, we're expecting the high-level meeting to be on the agenda of the WHO Regional Committee meetings throughout. Obviously, the timing of the regional committee meetings mean that they won't necessarily be able to influence the actual outcomes of the high-level meeting, because some will be taking place afterwards. But it will be a good opportunity for, at the regional level, to be discussing what comes out of the high-level meeting and implications at the regional level from a policy perspective. September will no doubt be an extremely busy month for us all. The UN General Assembly will be starting on the 18th. And then, as you'll be aware, our advocacy is very much focusing on ensuring that the high-level meeting for NCDs takes place just before the UN General Assembly. In addition to the high-level meeting on NCDs, there is also an anticipated UN high-level meeting on TB. And the modalities for that are also being ironed out in New York at the moment, but there is a chance that we'll have a TB high-level meeting back-to-back with an NCD high-level meeting. So two big global health challenges being discussed back-to-back in New York. Following that, in October, the UICC's World Cancer Congress will be taking place first to the 4th, followed by the Union's World Conference on Lung Health later in the month. Both great opportunities to be, again, following up on the commitments made by governments from the UN high-level meeting in September. And then moving into December is the Conference of the Parties for the Framework Convention on Climate Change on the 3rd to the 14th, and ending the year with the World Heart Federation's Congress in Dubai this year on the 5th to the 8th of December. So as you can see, it's going to be an extremely busy year, and what our ambition is that we're leveraging all of these major events to build pressure for strong commitments from the UN high-level meeting in September, and for the events following the high-level meeting to be good opportunities to be talking about next steps and implementation of those commitments. So that's kind of the year in a very swift whirlwind of an overview. And then obviously the rest of the webinar is focusing on what we can be expecting in terms of the big NCD policy discussions taking place at the Executive Board, and then preparations for the high-level meeting. So now let's move on to the second agenda item, and we will move to the second Global NCD Alliance Forum. With a presentation from Christina Parsons-Perez from the NCD Alliance to talk us through what happened in Sharjah and what are the next steps and expectations going forward. Over to you, Christina.
Thank you, Katie, and welcome everybody. And I am sure that perhaps a few of you joining us today were at the second Global NCD Alliance Forum that just took place in December from the 9th to the 11th in Sharjah, UAE. Next slide, please. The Global NCD Alliance Forum is organized by the NCD Alliance in collaboration with local host organization Friends of Cancer Patients, and it is possible thanks to the patronage of Her Highness the Sheikh of Sharjah. The forum is notable as the only global NCD civil society meeting to take place, and it has a strong focus on advocacy and capacity development. This is the second iteration of the Global NCD Alliance Forum. The first one took place in 2015, also in Sharjah, UAE, and in 2015, the forum was the first time that the network of national and regional NCD alliances were brought together. And with the forum taking place in 2017, this last December, the movement has since continued to grow, and the focus is less on the fact that the movement exists and really starting to delve into what this active civil society community is doing together. The timing was really quite perfect to look forward towards the UN 2018 high-level meeting opportunity, and so the forum was framed under the title of Stepping Up the Pace on NCDs, Making 2018 Count. Next slide, please. So much of the attention of the forum was really about facilitating advocacy campaign planning and mobilizing the community towards the 2018 high-level meeting, convening the diverse NCD community to share experiences and lessons learned and build new connections. And much was said and discussed regarding the need to put people first and to promote the meaningful involvement of people living with NCDs and of youth in the NCD movement. A series of there were a series of products that were launched at the forum, and we will discuss those in a minute. But it was particularly important that at the forum we launched the Advocacy Agenda of people living with NCDs, really making this point about involving people living with NCDs in the NCD response. The forum, as said, has a strong capacity development aspect to it, and so the program was built with this in mind. Next slide, please. So the forum brought together a group of nearly 350 delegates from 68 different countries. We're particularly keen on and pleased to see that we had representation from the different world regions. We had the vast majority of national regional NCD alliances in existence attend. We had 49 alliances attend. We set ourselves a target to really walk the talk. So we had 10% of delegates be youth and people living with NCDs as well. And the forum was really built around different plenaries and workshop streams over the course of 3 days, with 15 different workshops with a number of organizations involved, both global and national and regional. In addition, there was a youth pre-meet, of which I will speak a little bit more in a second. Next slide, please. So the fact that we were able to bring so many different NCD alliances together meant that this component of mobilizing the community towards the 2018 high-level meeting really started on the first day of the forum. And so there was an opportunity there for civil society representatives to sit together with their peers and counterparts from their regions to discuss the opportunity ahead. The NCD Alliance was able to share some of the background to high-level meetings, to give an overview of what is anticipated to come over the next few months, and we were also able to share the results of a consultation at the end of last year with the network to inform our advocacy campaign priorities. And so that draft working document was shared with the civil society representatives in attendance, who were able to really start discussing those priorities, which ones may be the ones that resonate most in their region and countries, and also to start discussing mobilization strategies for high-level participation. So how are we going to make sure that heads of state will be attending the high-level meeting? And another aspect of this advocacy planning opportunity and moment was to really start identifying what might be some regional advocacy opportunities. So are there any key meetings or processes happening over the course of this year that can be leveraged and influenced? There will be plenty of of opportunities for involvement of national and regional NCD alliances in the process and, of course, advocacy campaign towards the 2018 UN high-level meeting. And my colleague Priya will be discussing and going much more in depth into the 2018 opportunity. Next slide, please. So we had, with our emphasis on involving youth and people living with NCDs, we had the opportunity to bring a number of youth to the forum, and there was a really quite notable level of interest in attending the forum. So there was a competitive call for applications, and over 260 youth from across the world applied to attend, which is absolutely fantastic to see this level of interest of youth wanting to be a part of NCD advocacy efforts. There was a youth pre-meet that was organized and led by NCD Child in collaboration with other organizations in the Youth Planning Committee, and these organizations that we know are very active in this space, like IFMSA, YPCDN, NCD Free, the Commonwealth Youth Network, and so on. The pre-meet really served to prepare and prime the youth advocates to fully engage and take part in the forum, but also looking beyond and taking a key part in campaign efforts going forward. This particular group in attendance produced a call to action, Youth NCDs, and 2018 really a document really making the case on the priorities for youth with this advocacy opportunity ahead of us. Next slide, please. So there was a rich program offered at the forum, and over the course of it, we delved into advocacy, of course, for NCD prevention and control, and really kind of delving into some of the issues in the campaign priorities that will be discussed a little bit later in this webinar. And a lot was also discussed about the need for networking and working and reaching out to other communities in the sustainable development space, and then finally, just what are some of those kind of examples and tools that NCD alliances and civil society can use as we look to advocate on different issues. We had very we had a fantastic high level of speakers at the forum, and just to highlight some of our keynotes. Of course, we had His Highness the Sheikh of Sharjah speak. We also had Dr. Sanya Nishtar of the High Level Commission on NCDs, Dr. Anders Nordstrom from the Ministry of Foreign Affairs of Sweden, Professor Jeremy Schiffman, Dr. Tom Frieden, and so on. So a very high-level, high-quality program being delivered there. And in the next slide, you'll see if you were not able to join us at the Global NCD Alliance Forum, we will be sharing these slides online, and you have here the links for daily blogs that really talk you through the proceedings of each day at the forum. The forum launched these preliminary 2018 UN high-level meeting campaigns, priorities. It was also where we launched the Advocacy Agenda for people living with NCDs that you can find online, the NCD Civil Society Atlas that can also be found online, as well as a practical guide on tackling NCDs in workplaces in low- and middle-income countries. Next slide, please. Thank you to all of those who attended the forum, but also those of you that were not able to attend. There was social media was very active, and there were some activities organized at the forum itself to also promote social media engagement. So thank you to all of you that actively took part in that. Next slide, please. I would just like to go quickly through now a couple of aspects of the forum, and one of them was the Advocacy Agenda of people living with NCDs. This is an extremely powerful document. I encourage you to check it out online, and I would also like to thank you if you were involved in mobilizing your community or in actually taking place and helping us build the Advocacy Agenda of people living with NCDs. This was put together as part of the Our Views, Our Voices initiative, which is an initiative of the NCD Alliance and people living with NCDs, and it has drawn from the input of nearly 2,000 people living with NCDs from 76 countries, so from all over the world, all the different regions. There were two. It was put together drawing from an online consultation that reached nearly 1,000 people, and also community conversations that were conducted in 16 different countries and really explored key issues with groups of people living with NCDs. We were basically the point of this consultation effort was really to delve into what are the issues affecting people living with NCDs, what are their recommendations to decision makers, and how would they like to be involved in the NCD response. There was also a workshop that took place in Geneva that helped crystallize the consultation results and arrive at the advocacy agenda. Next slide, please. So what you'll notice is that it's a very powerful document, and it calls for action in human rights and social justice, prevention, treatment, care, and support, and meaningful involvement. It is a document that we believe will be of extreme use over the next 5 years, and the asks that you have, the calls of action, really make the case and come from the perspective of people living with NCDs, and they really make the case and bring to light, like, why does this matter? Why does action need to happen in these different areas? So really it is a compass to be used by us, the NCD community, to present to decision makers, to urge them to take action and to put people first. It's particularly interesting in that it can be adapted to the different advocacy opportunities that will present themselves, such as this year we have the 2018 UN high-level meeting that gives us an opportunity to drill down in some aspects that we are calling for action in that advocacy agenda. Next slide, please. The NCD Alliance has worked with national and regional NCD alliances to identify people living with NCDs as protagonists in a whole suite of micro documentaries that really try and make the case as to how are NCDs affecting people and why taking action matters. So these are available on our YouTube channel. These were produced with a collaboration between NCD Alliance and NCD Free, and we also encourage you to check these out. Next slide, please. Another product that was another outcome of the forum was where we launched the NCD Civil Society Atlas, and this is again a very useful resource for the NCD community. It basically showcases case studies of NCD civil society in action. And so we have examples there from 26 national and regional NCD alliances. The selections were made by a review panel of external experts. They were classed according to different assessment criteria in order to make the cut and be featured in the Atlas. And it basically provides a snapshot of how civil society is contributing to the NCD response in its 4 different key areas, or key roles rather: advocacy, awareness, access, and accountability. The cases featured are from alliances from across the world, and so it really is to share good practice amongst the NCD civil society community. Next slide, please. And it really is to support the NCD community at large and those working on NCDs, and to inform the response. It really is a document that can be used as we make the case as to why civil society, for instance, should be having an active role in the NCD response nationally as well as globally. So this publication really seeks to crystallize how civil society, what exactly NCD civil society is doing in an organized and systematic manner. And my final point here is that we were delighted to be able to present the Sharjah Awards for NCD Civil Society Excellence that were awarded by the forum's patron to the highest rated cases in each of the different categories. So for instance, we had the Advocacy Award went to the Latin America Regional Alliance, to CLAS, for their rapid response system in place to support national advocacy efforts for awareness to the Tanzanian NCD Alliance, and accountability to the East Africa NCD Alliance, and the Access Award went to the Healthy Caribbean Coalition. So if you would like to know more about what different alliances are doing and to be inspired by this work, I really encourage you to check out this resource. Next slide, please. So finally, next steps. The forum really served to energize the NCD Civil Society community and to really start discussions around and planning around the 2018 UN high-level meeting. So you'll be hearing much more about the UN high-level meeting campaign. We will be looking to ensure active participation of civil society, of course, and the meaningful involvement of youth, people living with NCDs. We will be sharing a report of the Global NCD Alliance Forum. The evaluation, if you did attend the forum, the evaluation of the forum is still open until the end of this week. I believe we might be able to share it here in the webinar. If you attended, we please encourage you to respond to that evaluation. And then finally, we will also be sharing with you soon the report of the consultation of our views, our voices. And thank you, and over to you, Katie.
Thanks, Christina, for that great presentation and for sharing with us all the deliberations and outcomes from the forum, which is a really fantastic event last year, and really to try and encourage everybody on the line. If you haven't looked at the Advocacy Agenda for People Living with NCDs, it is a really fantastic resource, which, as Christina presented, has had a really kind of robust methodology of how we came to the specific recommendations, very much led by people living with. So we're really hoping this is kind of at the beginning of a new era for the NCD community in terms of really elevating the voice of people living with throughout our advocacy efforts. We had one question, Christina, about the advocacy agenda. There was a question around, does the document have in there anything specific on tobacco control as a solution perceived by people living with NCDs?
Yes, it does. And what you will notice as well, if you look at the advocacy agenda, is that it actually has a whole series of calls for action in the area of prevention. And this was something that we actually explored in our consultation efforts, and an overwhelming amount and majority of people living with NCDs, of respondents, specifically said that they felt that they had a role to play in advocacy efforts on NCD prevention. So this is very interesting to us, that this idea of putting people first and engaging people living with NCDs in the response and in advocacy efforts, we see the opportunity to do this across the whole continuum of NCDs, from prevention through to treatment.
Great. Thanks, Christina. I think in the interest of time we'll move on because we have a lot to cover today, but thank you for the presentation. Just as a quick reminder, someone asked the question in the chat facility. We will be posting the PowerPoint slides up on our webinar, on our website, after the webinar, as well as the recording of the webinar. So for those who aren't able to join right now, we'll be able to listen in afterwards. And as a reminder, if you do have questions, please use the chat facility at the bottom of your screen, and then we will come to Q&A after each of the agenda items. So our next agenda item, we will move to Dr. Felicia Knoll, who I believe has joined us now on the webinar. We are really pleased that Dr. Felicia Knoll has joined us, who's a long-standing friend to the NCD Alliance, and obviously a long-standing advocate and expert in the fields of cancer, NCDs and palliative care specifically. Felicia has been one of the key architects behind this new Lancet Commission report on palliative care and pain relief, which is extremely relevant to the whole NCD community. And Felicia is now based at the University of Miami as a professor at the School of Medicine. So we're really pleased to have you on the line, Felicia, and over to you in terms of presenting on the key findings and evidence found in terms of the Lancet Commission report.
Katie, thank you so much, and to everyone who's joining us. We're here from the University of Miami, and many of the team who worked with me are now here with us. Let me just apologize for not being able to be with you from the beginning of the call. A working mother whose child got sick at school and had to be picked up. It happens to all of us, so my apologies for that. But always somehow has to come first. So thank you very much for adjusting. As Katie said, I really do consider myself a long-time friend of this incredible alliance from when I was on the UICC board, and it's amazing to be able to collaborate with the alliance and with the Secretariat and with you, Katie, on this. So what we're going to do this morning in the moments that we have is to share with you some of the highlights of our report titled Alleviating the Access Abyss in Palliative Care and Pain Relief, an Imperative of Universal Health Coverage, and then discuss some of the next steps and the work that we're doing, particularly on follow-up with the IHPC, and I believe we also have their director, Liliana de Lima, joining us this morning. So if we go to the next slide. I wanted to start by quoting the editorial that Richard Horton, editor-in-chief of The Lancet, wrote to accompany the release of the report. And he titled that editorial, A Milestone for Palliative Care and Pain Relief. And he really gave us a call to action. He wrote, measures of suffering have been absent, and so the need for palliative care and pain relief services has been easy to miss. That excuse no longer holds. The scale of human suffering is massive, and the Commission has uncovered an appalling oversight in global health. It is time for that oversight to be remedied. The reason that we're here with you today is to ask for all of your support and collaboration to work with us, to be able to work with you, to be able to integrate universal access to pain control and palliative care into all of our efforts related to universal health coverage overall, and of course, the NCDs specifically. Next, please. Thank you. Just to give you an overview of what went into making this Lancet Commission and its report, it was a 3-year endeavor. It is one of the Lancet's official global health commissions. If you go to their global health website, you will see a list of now more than, I would say, 20 commissions over the last 10 or so years that have been, I think, incredibly successful, not only for research, even more so for generating tremendous change in global health in our world. Our report came out officially on October 12th to 13th. It is freely available online, as are the other Lancet Commission reports. It includes a podcast. It includes, obviously, Richard's editorial, where he calls this, which was very wonderful of him to do, a landmark report among the reports. The report itself is led by the University of Miami, and we're pleased and proud to have been able to support this work in collaboration with Harvard University, where this work began. The Secretariat team, as I said, some of them are with us this morning. Asa Bedelia, Natalia Rodriguez is here with me, and others, including our team from the Mexican Health Foundation, who worked very closely on making this possible, along with my co-chair, Dr. Paul Farmer, 33 additional commissioners, and in total 61 co-authors representing 25 countries from around the world. This is really a so-called diagonal approach that we have taken as a way to work on health systems as a group, where we neither think vertically across diseases nor horizontally only across health systems, but rather in a way that merges and integrates so we can find a set of innovative solutions to some of the greatest tragedies and challenges affecting health in our world. And so in this case, what we did was to bring together in our commission experts in health systems and global health with experts on palliative care, some of whom are there in the picture. And there are several who truly led this effort, including Eric Krakauer, Liliana de Lima, Kathy Foley, among the many palliative care specialists who participated, and then also among our global health leaders, again, Paul Farmer, Julio Frank, Dr. Mary Gospodarowicz, Dean Jameson, and this fed into the whole disease control priorities 3, thanks to his seminal work on this report as one of the lead, if not the lead economist. Next, please. The 5 key messages that anchor this report are the following. First, that the alleviation of the burden of serious health-related suffering, which in the rest of the presentation we call SHS, so serious health-related suffering, from life-threatening or life-limiting conditions and that go along with end of life, is a global health and equity imperative. We established that. Second, that universal access to an affordable, essential package of palliative care can alleviate much of the burden of serious health-related suffering. Third, that low and middle-income countries can improve the welfare of poor people at very modest cost by publicly financing the essential package of palliative care that we developed and put forward, and through full integration of that package into their universal health coverage. 4, we require international and balanced collective action. Balance here talks about the difficult, the fine line between managing the pain crisis in our world and the risk of opioid epidemic. And so a balanced collective action approach is essential to achieving universal health coverage of palliative care and pain relief by facilitating effective access to essential medicines while at the same time implementing measures to prevent non-medical use. And finally, we call for better evidence and priority-setting tools anchored in our work on serious health-related suffering, and that these must be generated to adequately measure the global need for palliative care, implement policies and programs, and to monitor progress globally, regionally, and at country level in alleviating the burden of pain and other symptoms of serious health-related suffering. So those are our 5 key anchor messages. Next, please. I want to share just a few of the highlights of the findings of the report. I don't expect us to go through what this slide is telling us in terms of the actual results, but what we did decide was important to share with this group is that we first, to develop our measures of serious health-related suffering, identified the 20 health conditions that are most associated with a need for palliative care. And of those 20, although some are communicable diseases and injury, the majority are non-communicable and chronic diseases, and they're in that particular list: malignant neoplasms, renal failure, cerebrovascular disease, liver disease. They're listed along the bottom. So these 20 conditions are then broken down across the number of people in 2 different ways. One is those who die in the year of our analysis, which was 2015, and the other is that those who live with these illnesses or diseases over that period and do not die but experience serious health-related suffering that would likely require pain relief and palliative care. On the bottom 3, you see that we can also divide our data, and this is how we calculated the other facet of serious health-related suffering, is the number of days of suffering. And so we analyzed 11 physical and 4 psychological symptoms across each of these health conditions in order to give then a picture of the number of people that are affected and the number of days of serious health-related suffering in our world. A lot of this work was anchored by the team that of physicians and palliative care and pain relief experts led by Dr. Eric Krakauer from the Harvard Medical School. Next slide, please. When we put these data together, what we find is there's a huge burden of serious health-related suffering. 25.5 million deaths, which is 45% of the 56.2 million deaths worldwide in 2015. And in addition, at least 35.5 million people we call non-decedents who did not die in that year, but were diagnosed or suffered through in that year these types of suffering and health conditions required palliative care. This gives you a total of more than 61 million people worldwide suffering more than 6 billion days of suffering and up to 21 billion days. And 80% of those are in low and middle income countries where there's very little access to pain relief and palliative care. Next, please. To meet the need for palliative care and pain relief, our commissioners designed an essential package in line with the work of the Disease Control Priorities 3 group. Medicines, medical equipment and human resources, and really what is most essential is in this package. And therefore, we call as a group to align universal access to this package with the SDGs by 2030. Now, the fulcrum of this package is pain relief, because we require to offer palliative care in most settings, the most basic of basics, and that being morphine. And so we then looked at need compared to what we might call a minimum to meet that need, which is access to pain relief through oral, immediate release, and injectable morphine, which is one of the least expensive medicines available in our world. Next, please. Looking at access to morphine gave us an idea of how poor coverage and access is around our world. It's also an indicator, a way of expressing need through pain that's very palpable and should be to our global health environment and those in our world. And it's one that's been ignored largely, despite what it should have been in all of what we do on global health. The global inequity, the commissioners, when we looked at this, felt that this was probably the most inequitable distribution we had ever seen in the combined centuries of work in global health that we're sitting around the table and doing this analysis. The summary statistics, the poorest 50% of the world's population receive less than 1% of all the morphine equivalent in our world. And the richest 10% of the world's population have 90% of all the morphine. Next slide, please. The image that has been most strongly, I think, felt in the Lancet and by those who have read the report and projected forward is this map. And what this map is doing is identifying unmet need for pain relief. It takes morphine equivalent around the world and uses as the denominator serious health-related suffering, so the need for palliative care, for pain relief-related palliative care. And instead of looking at square kilometers, what you're looking at the map is the unmet need for pain relief through the most basic types of morphine. The rest of the world, other than the U.S., Canada, and Australia, appear very tiny in our map. Europe, Western Europe, is about the size that it should be. We see it as the gold standard for what's available in country and to patients as part of universal health coverage. But Latin America, certainly the Caribbean, much of Eastern Europe, Russia, you can see, Asia, look at China, look at India, that becomes a tiny little line on our map. Africa virtually disappears because we are looking at coverage and access or met need, in many cases of well below even 5%, and this is only considering palliative care need, not the other needs for morphine that go along with many diseases and conditions, including NCDs. Next, please. So that map gives us an idea that we are probably speaking about 85% of serious health-related suffering being unmet in our world, and that being largely focused, not entirely, but largely focused among the poor. We next look at what would be the cost of closing that gap in terms of morphine, and considering the least expensive oral immediately release tablet form and injectable morphine. And at current prices, we come up with $600 million. At best international prices, given what high-income countries currently can look at as the price they pay, it's $145 million. And that difference, that finding, we look at throughout the report because it talks to us about a market that isn't working. One of the pieces of data that struck us as sad and at the same time incredibly hopeful is that to meet the need for all children for serious health-related suffering in low-income countries, the need for morphine equivalent is just over $1 million US. And I kept asking myself when this number came up, how is it possible that our global institutions, that UNICEF, can satisfy $1 million to be able to close that gap, at least for children? So these are very palpable, very affordable solutions to global health, and we seldom find this kind of an opportunity in global health for a win-win, one that's not expensive and is feasible. Next, please. Without going into detail, I just wanted you to see that the rest of the report talks about how to strengthen health system functions to guarantee universal access to palliative care and pain relief. And we look at very specific recommendations for countries in terms of stewardship, financing, delivery, resource generation, and information and research. So the building blocks, the key health system functions that any health system needs to manage effectively, and this speaks just to the palliative care and pain relief aspects. Next, please. The other that we deal with in some depth in the report is to think about how the advocacy community, how civil society can catalyze change, looking at experiences across a number of countries. And one of our major recommendations is that we need to promote national palliative care associations that also consider pain relief. And when we speak about associations, we think of interinstitutional, multidisciplinary national committees that can push forward implementation, but also monitor commitments, compliance, and progress of countries. And this really requires a cross-disease approach, because this isn't only, as you saw in the original data, just about cancer or just about TB or just about AIDS or just about any other single disease. Palliative care is something that's required by a number of disease communities and patients around the world. So we're beginning to push forward, and through the report suggests, how can we mirror the sort of Lancet Commission that we developed at country level. Next, please. In our follow-up work, which we want to do with you, we talk about advocacy, in-country implementation, global collective action, and research. Just to note on point 3, the global collective action, is that we are working very closely and in a way that I think is very exciting and potentially interesting with the World Bank through the Office of the President to think about ways to identify, not specifically for palliative care and pain relief, but expanded opportunities to be able to have investment opportunities for countries to meet the challenge of NCDs that's inclusive of palliative care and pain relief. And we've been talking with Katie about that, and I look forward to having more information soon in the future on where that particular piece is going. But I just wanted to talk briefly about the advocacy and country implementation opportunities. Next, please. So we have put together an implementation working group anchored by the International Association for Hospice and Palliative Care, coordinated in collaboration with the University of Miami, but very specifically with the Worldwide Hospice Palliative Care Alliance, the International Children's Palliative Care Network, and regional palliative care networks and associations from around the world. This was actually something that the Lancet required us to do as part of the publication, and it was great that they did so. They asked us and said, to go forward to final review, we need you to tell us how you're going to move forward to implementation with the results of your research. So in terms of activities of this group, we're looking at developing monitoring frameworks and public accountability tools, supporting the national commissions that we just mentioned, promoting knowledge generation and exchange platforms, and creating interdisciplinary and multi-sectoral linkages between the palliative care community, the non-communicable disease movement, and broader development and global health efforts. And that is exactly why we're here talking to you on this webinar. Next, please. Now, finally, to make that happen, there are a number of items in our developing toolkit and dissemination activities that I wanted to share with you. One is, again, the publication itself, which is a free download, now available online at the website you see there with its executive summary. We have a data appendix that gives all in detail, and we're very pleased to share the calculations and the raw data. And there's a podcast. In addition, we have a series of fact sheets that are clearly designed for advocacy that are at your disposal. We have a base PowerPoint and training videos that are being developed that we want to share with you. There's quite a bit of media coverage that came out around the October launch, and we have a list to be able to share, and that gives also, I think, a very good idea of reporters around the world who are interested in this. We're developing blogs and hope to produce input, for example, for the the NCDA newsletter, among others. There's one that's just come out in the IHPC newsletter. We're participating in webinars like this one. There'll be another with the Pan American Health Organization that will be done in several languages. We are promoting country launches. And finally, to close, to invite all of you to join us at the Global Launch Symposium, which will be undertaken with the Lancet and with Dr. Richard Horton at the University of Miami on April 5 and 6. At that point, we'll be releasing the print version of the report. And so that's the last part, to invite all of you to join us. We will share all of this information through the NCD Alliance and with any who are interested, and we're here to collaborate. So thank you very much for your time.
Thanks so much, Felicia, for that fantastic presentation. Really, really informative, and great to get an overview of all of the really important elements of data and evidence that you've built through the Lancet Commission's work on palliative care. And obviously, as you said near the end there, that this report is really relevant to the whole NCD community. I think there's sometimes been a bit of an assumption that the palliative care is just about cancer, but as you highlighted at the end, it really is relevant to all different areas of NCD. So this is a really important part of the Global NCD Agenda and really important evidence for our advocacy work going forward. There's a couple of questions that have come through, if you have time to stay on for a few more minutes. Firstly, in terms of one question that came through was, are there any funders that want to support the implementation? I think that's more a question about a specific initiative. One question that's come through is, how can essential medicines list for children be used to promote access to palliative care and pain relief?
So first, I don't know if Julia Downing is with us on the webinar. She is clearly, in the terms of the co-authors, I would say the expert that helped us to make sure that the report spoke, I think, effectively to the issue of children. The short answer is that we looked at both in all of the different parts of the WHO essential medicines list, both being children and adults, in putting together the essential package that we've put forward. That said, the next step in the work that is required and is not yet funded is to do a specific essential package for children for palliative care and pain relief. In other words, the dosage, the titration is adjusted, the necessary medicines are included in the essential package. But we need to have two kinds of next steps with that package. One is children, another is to go beyond, which is the most essential, to include, for example, chemotherapy, radiation therapy, and additional aspects of surgery for countries that can get above, and there are many, the minimal level. So the essential medicines list were huge tools. Second part that I do want to mention is that we were, and I still am, shocked at the variation in prices for morphine. So we saw around the world some countries paying more than 30 times the minimal going price that should have been available to all that was being paid by certain wealthy countries around the world. We don't yet have the answer. We're trying to begin to study how these markets work and why they work so poorly. These are small parts of any health budget, but it makes no sense to be paying that much more of a premium for medicines that are really inexpensive and off-patent. And finally, on the children's piece, one thing that's really very essential is that in countries where they are not, and this includes, at this point still, for example, Mexico, where the essential packages was covered, doesn't include liquid versions of oral morphine for children, and particularly for small pediatric patients. The only option are to crush tablets, and that's a very second best option to being appropriately able to titrate liquid formulations of appropriate pain relief medication.
Thanks, Felicia. We've got another question around, is there a need in low and middle-income countries to develop a special health workforce to attend to palliative care needs, or should it be performed by the already existing medical workforce?
So we call for, and we're not the only ones, there have been many in the palliative care community and pain relief community have called for this, and I think it's the right thing to do, that no medical professional, that includes health promoters, nurses, as well as physicians, and we've also extended it to clergy who work with patients who are at end of life. So no medical care professional should graduate and be certified without minimal training in palliative care and pain relief. And that means that the healthcare workforce would be able to manage and implement the essential package at any level of care, including the primary level of care. That's what it's designed to do. The other reason that I think that's incredibly important is when we analyzed, and we did have to do this, what lessons could be learned from the U.S. opioid epidemic. One of them is that appropriate training of primary health care personnel, and particularly physicians, is essential to guarantee that medications that have risks of addiction are effectively made available to patients in pain who require them and are not derived into other kinds of use inappropriately. That requires basic training, but that kind of basic training, we believe, has to be part of basic medical training. And the reason is that when we think about universal health coverage, the definition the WHO has put forward, and one that we believe in strongly, is that there cannot be universal health coverage that does not include palliative care, which means it has to be an integrated component of each aspect of how the healthcare system functions, down and including the primary level of care. The other, I would say, is speaking from a human rights point of view, and from any of us who have had to witness a patient in pain or at end of life without access to pain relief and palliative care, that doesn't satisfy any individual's basic human rights. And every medical care professional should consider it part of what they have to offer to every patient to alleviate that.
Great, thanks. One final question from me. You mentioned in your slide around the estimations of cost in closing the access gap, and you said that for all children in low-income countries, we're looking at a figure of around $1 million US. This isn't a large amount of money we're talking about, so I'm kind of curious to know where you think finance and funding for palliative care and NCDs more broadly will come from.
Now that's a tough question, Katie. Well, it's partly the NCD Alliance and all, without any question. So first, that figure, when we came to that figure, we tortured the data to make sure it's right. First of all, coverage for children in low-income countries is virtually zero. So this is almost all children with need that have serious health-related suffering. It is simply that, and this is anchored in research published by Dr. De Lima, for example, there is a price of 3 cents per tablet in the world for oral immediate-release morphine. It is a very inexpensive medicine when it's used in its most basic form. And so there are few children, and the medicine is inexpensive, or should be. Let me just add, though, there that these figures, and I think this bridges into the other part of your question, which is how to fund all of this, including NCDs. So we included an important calculation of what you might call avoidable mortality, and this was something that Paul Farmer insisted on, and he was absolutely right. And when you look at how many of the deaths that require palliative care should never have happened in the first place, many but all, not all being NCDs, several are obviously communicable diseases as well, you get figures, and they're in the report, in some cases of above 90%, for example, for children in low-income countries, whose death should not have happened. Doesn't mean they didn't need any kind of pain relief for what they're suffering, but the death should not have happened. So this is a calculation that speaks about how the world is today in terms of need. Much of this need should never have happened in the first place if we had been effectively preventing and treating non-communicable diseases, preventing many communicable illnesses and diseases. Now, where can this come from? So the basics, the gap in morphine, I think just requires concerted action by existing institutions like UNICEF around children. But that isn't really how to do this. I believe that we can think with our financing institutions, and I also know that there'll soon be an interesting release by the Bloomberg Commission with other collaborators around how to think about innovative financing, specifically for NCDs. So our international financial institutions, and I think some of the economic leaders in our world, are poised to think about how we can use the finance system to be able to leverage the necessary funding to be able to support countries to move forward on NCDs. And I don't think we can take our finger off of that as a global health community. We need to support this group of economists who are willing to think through with us how to get the investment that's required and then make sure it goes into the right places to satisfy needs like palliative care, but also to work along the continuum of care so that we are preventing the deaths that we can prevent and the illnesses that we can prevent and treat. Great.
Thank you so much, Felicia, for joining us and for the presentation. Just a reminder that for people to obviously revert back to that slide that Felicia talked through in terms of the Toolkit resources and dissemination activities. There's a wealth of information there and useful resources based upon the Lancet Commission's report. And also we as NCD Alliance will be including the Palliative Care and Pain Relief Commission report and tools in a newsletter in the next few weeks. So thank you again, Felicia, for joining us and presenting today.
So much for all you're doing.
Thank you. So let's move on to our next agenda item, which builds upon nicely Felicia's presentation. We're now moving on to the UN high-level meeting on NCDs, obviously the big opportunity for all of us from an advocacy perspective to be ensuring that governments are making bold and ambitious commitments, as well as obviously reviewing progress on how far we've come in terms of NCDs. So let me pass over to Priya Kanaisen in New York to give us an update of where we are in terms of the process for the UN high-level meeting.
Thanks very much, Katie. So I will give a brief update on preparations for the high-level meeting, and if we do not cover any questions that you might have, please do send them after the webinar. Next slide, please. So as I think many of you are aware, the high-level meeting this year follows on from the two previous meetings, the first in 2011 where member states adopted a political declaration where they recognized NCDs as a global development challenge that necessitates political attention at the highest level. And the second meeting in 2014 where member states reviewed progress towards achieving the 22 commitments they agreed in 2011 and setting out new time-bound commitments that really shifted the focus from global to national level action. This year, member states will have the opportunity to review NCDs within the Sustainable Development Goals and recommit to addressing NCDs at the highest political level and review progress on the commitments that they've made in 2014 and 2011. One thing to note, in 2011, the attendance was indeed at the highest level. We had heads of state and heads of government. In 2014, it was more at the ministerial level, and in 2018, the level of participation is yet to be determined, but the importance of having heads of state and heads of government cannot be stated enough. Next slide, please. So as always, September at the UN in New York is always quite busy, and this year will not be any different. As you can see, this is a just graphic of some of the things that are scheduled for September that we anticipate will be scheduled in September. The dates for both the high-level meeting on NCDs and on tuberculosis are still to be determined, and I'll go a little bit more into the process for that a little later. But we do know that the co-facilitators for this process have been more or less selected. They will be announced in the next coming weeks. So for the high-level meeting on NCDs, the co-facilitators will likely be Uruguay and Italy. And for the high-level meeting on tuberculosis, there's likely to be Antigua and Japan. One thing that we are now aware of that will be taking place in September, just prior to the opening of the general debate, is the Nelson Mandela Peace Summit, and this is commemorating the 100th birthday of Nelson Mandela. So this will take place on Monday, the 24th of September, and the process will be led by South Africa and Ireland. So this means that the dates available for high-level meetings are Sunday, the 23rd of September, and also Monday, the 24th of September. There is a possibility that they will have both the summit and the high-level meeting on the same day, but again, this is to be confirmed. So as you can see, September will be quite packed, and we'll talk a little bit more about the process for deciding the dates. Next slide, please. So this slide gives a visual of the process that lies ahead. It all kicks off with the appointment of the co-facilitators, as I mentioned, likely to be Uruguay and Italy for the HLM on NCDs. And these co-facilitators will guide member states through the modalities resolution process and intergovernmental negotiations to agree the outcome document of the high-level meeting. And I'll go into more detail onto each of these three steps in the process. The Secretary General of the UN will also publish his progress report on NCDs, and we're expecting that to be public in about 2 weeks. The report will then be discussed by member states at the General Assembly once co-facilitators are appointed. And in parallel, the high-level meeting on TB, it's undergoing the same process to decide how this high-level meeting will play out. They are a bit ahead in the game in terms of their progress report has already been published, and their co-facilitators have been appointed. Next slide, please. So the co-facilitators are quite an important part of this process. They are two member states who are regionally representative and have not been a co-facilitator for an HLM on NCDs before. They are often chosen after expressing interest in the process or in the specific issue, and they really guide member states over the modalities, which is the process, and sets out the logistics of the high-level meeting, as well as negotiations to agree the outcome document. As mentioned before, it is likely that Uruguay and Italy will be announced as co-facilitators, but that will only be final once the President of the General Assembly announces who the co-facilitators are. Next slide, please. So once co-facilitators are chosen and the member states discuss the Secretary General's progress report, we begin the modalities resolution process. So the modalities resolution is an intergovernmental document that decides the date, timing and length, level of representation, agenda, speakers, and civil society participation for the high-level meeting. So some things to consider for the modalities, we will know once this is agreed whether the high-level meeting on NCDs will take place in September, whether it will be 1 day or 2 days, whether member states are calling for heads of state and government to attend, and whether they will agree to hold a civil society hearing, as well as convene a civil society task force to really facilitate participation and engagement of civil society. So as you can see, this is really quite an important process as it sets the tone for the entire HLM. Next slide, please. So once the modalities are decided and agreed, the co-facilitators then move into the outcome document negotiations. And this, again, is an intergovernmental process that takes place in New York, and we expect this will take place between the months of April and July. Of course, this is all to be confirmed depending on when the high-level meeting will take place. So the co-facilitators teams produce a zero draft of the document, which is basically an initial version that member states provide comments on. The document is negotiated in New York by missions with technical support from their counterparts in Geneva and WHO. This point is actually quite important, as the HLM is a political process and not a technical one, so the outcome document must reflect that, which is why we are really pushing member states to ensure that all aspects of the outcome document are negotiated in New York. That'll prevent it from falling into a technical process and producing an outcome document that's really quite lengthy and not political in nature. So member states negotiate in political and regional blocs. Some can be more influential than others, and this is really an opportunity where civil society can engage in their regions and with the chairs of those specific blocs to ensure that we're getting our messaging across for our priorities, and also really to encourage civil society participation. Next slide, please. So the third high-level meeting on NCDs is really quite an important moment for the NCD community. Both political and public attention is growing, as also is industry backlash against some of the NCD interventions and best buys. It's more important than ever for political will and action to deliver on the commitments made at the UN and WHO. So the HLM provides an opportunity for us to examine non-communicable diseases within the context of the SDGs, highlighting linkages and benefits of shared solutions. So it's really something that we can do to link NCDs with the broader conversation around sustainable development. It also enables us to link with the TB community and highlight the synergies and opportunities for joint action, especially if the HLMs on TB and NCDs are back-to-back. It's really an opportunity for us to discuss comorbidities and discuss shared solutions. We also know that NCD Civil Society is stronger than ever at all regions, at all levels, and we have greater pressure from us as civil society on member states to really agree strong, ambitious outcomes. Of course, with these opportunities come some challenges, including the fact that there are several high-level events in September, scheduled for September, such as the Peace Summit, UNGA itself, and the HLM on TB, which we anticipate will also be in September. There's quite limited technical capacity in New York missions. Not all of the missions have a health lead, so that can be a challenge. Of course, there is the rising industry influence in terms of commercial interests obstructing the commitments that could be made at the UN, at the HLM, such as the WHO best buys. And we did see this happen in the lead up to the Montevideo conference on NCDs that took place last October. So it's something that we know will happen and that we can prepare for. And owing to the multiple events is competition for media space, issues of logistics, etc. Despite this, there are many entry points for civil society to influence the process and outcome and really push for an ambitious outcome of the HLM. Next slide, please. One of these entry points is the modalities resolution process. So as mentioned earlier, this happens once the co-facilitators are appointed, and we anticipate this will take place in February. One thing to note is that the modalities process for the HLM on tuberculosis will take place prior to the process for NCDs. So we can sort of anticipate how the NCD modality process will unfold based off of how TB will go. NCDA developed some process priorities for the modalities resolution, and the link will be live in the slides that we share after the webinar. We are calling, of course, for a September meeting, high level, alongside the TB HLM, calling for heads of state and government to attend 1 or 2 days. Of course, all 2 days would be ideal given the competition for time and space. We think 1 day is more likely, but that is to be determined, again, by the modalities. Involvement of civil society, such as convening a civil society task force, a civil society hearing, which is really quite an important opportunity for civil society to engage in an exchange with member states to share their priorities, concerns, and really what they want member states to commit to in this outcome document. So the civil society hearing is really quite an important process. And then, of course, adopting an ambitious outcome document that has new, bold, time-bound commitments for member states to really deliver on and address the tide of NCDs. Next slide, please. So hand in hand with the modalities priorities, we also have outcome priorities, and these will really be for the overarching priorities that will guide our advocacy campaign for the outcome document of the high-level meeting. These priorities will be launched at the WHO EB Executive Board meeting next week, and my colleague Elena will be speaking about that more shortly. These 6 priorities were arrived at after extensive consultation that we conducted with external and internal partners. And these overarching priorities are putting people first, people living with NCDs, their carers, people at risk of anyone who is affected by NCDs at the front and center of the movement. Boosting NCD investment and financing, and that links in with some of the broader conversation around financing for NCDs and more broadly the SDGs. Stepping up action on childhood obesity, taxing unhealthy commodities, and as mentioned earlier, we know there's quite some strong pushback on that. Ensuring equitable access to NCD treatment and care, and improving accountability across the board to ensure that we can track and monitor progress. So in December at the second Global NCD Alliance Forum, we shared a discussion paper that sort of describes these priorities in more detail. So you can access that there until we launch the official priorities. All of these priorities are meant to encompass all of the NCD diseases and risk factors, and are really underpinned by more specific actions that will help drive the priorities. So this will be further described in the outcome priorities document that we share next week. Next slide, please. So in terms of next steps, we will be launching our advocacy priorities and really using this to guide our advocacy across the board to drive an ambitious outcome for the high-level meeting. We're engaging in really active member state advocacy, both in Geneva and New York, to encourage member states to support the high-level meeting in September with high-level participation, and encourage them to support the civil society briefing and task force. We're in the process of conducting mission briefings, and also encourage you to connect with us for opportunities to really conduct some briefings in country and sensitize governments to the issue. There is, of course, also the WHO Civil Society Working Group on NCDs that the Director General convened in October, and so this will really be advising the WHO DG on participation of civil society throughout the HLM process. And I believe the names of the people who will be on that working group are to be announced by WHO shortly. So I will leave it there, as I know we're pressed for time, and pause for any questions.
Thanks very much, Priya. Excellent presentation as always, and good to be walked through the kind of complex process of the modalities resolution and everything that's going on in New York related to the high-level meeting. We have one brief question which I think we can probably follow up via email with from Deanna, and she asks if we can provide the chairs for each of the political blocs at the UN. So I'd suggest we follow up via email on that one. And I think we need to keep moving because we are slightly behind time. So thanks again, Priya, for that really good presentation. Let's move on to our last presentation, which is Elena Matska, who will be talking us through the WHO Executive Board, which is taking place next week. Over to you, Elena.
Thank you very much, Katie, and hello everyone to this webinar. I'm going to walk us very briefly, given the short time that's left, through the Executive Board session. This January's Executive Board session is of particular importance to the NCD community, both because of the ongoing development of WHO's General Program of Work for the period 2019 to 2023, as well as the ongoing preparatory process of the 2 UN high-level meetings later this year on NCDs and TB. Next slide, please. I'm going to start by moving us very briefly through the agenda of the Executive Board from an NCD perspective. There's 2 agenda items in particular. The first one on strategic priority matters that are important for us. Agenda item 3 covers the General Program of Work. It also covers health, environment, and climate change, the shortage of and access to medicines and vaccines, public health, innovation, and intellectual property, the preparations for the high-level meeting on NCDs, and the high-level meeting on tuberculosis. And once we share all of these slides, the links on my slides, the slides will be active, and you can access directly the Executive Board documents and the provisional agenda. Next slide, please. The second agenda item that we'll be following closely is titled Other Technical Matters, under which we will be following the development of a global action plan on physical activity for health, an update on the global strategy for women's, children's, and adolescents' health, and also 2 reports related to nutrition. Next slide, please. In terms of the timetable, currently the order of discussions is as follows. EB opens on Monday. I would assume that most of the day will be taken up by discussions on the General Program of Work. On Tuesday, agenda item 3 then continues, and according to the current state of the agenda, will lead us up to agenda item on health, environment, and climate change. And then on Wednesday, we'll finally get to the report on NCDs, agenda item 3.8, and the discussions are intended to go all the way up to the agenda item on physical activity. Now, this may be pushed back. We may see some of these agenda items pushed over to Thursday, which is dedicated to agenda item 4, Other Technical Matters, which then includes the report on the global strategy for women, children's, and adolescents' health, and eventually moves on to agenda item 5, which is on managerial, administrative, and governance matters, which also, for example, includes the WHO framework for engagement with non-state actors. Friday is also taken up by agenda item 5, and Saturday will be dedicated to information matters. Next slide, please. Next slide. I'm going to start with what will surely be the main focus for most member states, and that's the draft General Program of Work. The General Program of Work was discussed at a special session of the Executive Board in November and was revised since those discussions. What you see here on the slide may be familiar for you already. It's an overview of the draft General Program of Work with its mission on promoting health, keeping the world safe, and serving the vulnerable. And underneath, you have the strategic priorities, which are advancing universal health coverage, which also includes NCD treatment. Then you have addressing health emergencies and promoting healthier populations. Under this third strategic priority of promoting healthier populations, we find NCD prevention included as one of 5 platforms. These 5 platforms are firstly improving human capital across the life course. The second one is accelerating action on preventing NCDs and promoting mental health. The third one is accelerating elimination and eradication of high-impact communicable diseases. The fourth is tackling antimicrobial resistance, and the fifth is addressing health effects of climate change in small island development states and other vulnerable settings. So you can see in this graphic that the way it currently stands, NCD treatment is really kind of included under the first strategic priority, and NCD prevention is focused in the third strategic priority. At the epicenter, if you will, of this draft general program of work is a focus on country action, driving impact in every country. This will become the focus of all levels of the organization, or at least that's what the draft general program of work tells us. For some country settings, this means this is more focused on upstream policy advice, and for others, it's more focused on the downstream delivery side of things. Next slide, please. With regards to the general program of work, there are several documents that the Executive Board will be considering. We're still waiting for an updated impact framework, which I understand will be uploaded today. And there's also now a financial estimate for the general program of work, which I will be talking to in a second. Changes from an NCD perspective since the special session of the Executive Board is that it's notable that Platform 2, and that's the platform focused on NCDs under Strategic Priority 3, Healthier Populations, is now exclusively focused on NCD prevention. And NCD treatment falls entirely under the Strategic Priority of Universal Health Coverage. This makes logic sense, but for us it's certainly a major priority to ensure that the indicators that are used under the strategic priority of universal health coverage actually work to accelerate access to accelerate and improve access to NCD treatment. We have some concerns that currently the selected indicators aren't sufficiently focused on delivering NCD best buys, but it's a bit hard to tell because we're still waiting for the updated impact framework. There is an added focus on physical activity that wasn't covered in previous drafts of the general program of work. There's also a stronger focus on the life course approach to health, in particular aging, but also early childhood development. And there's improved palliative care language, including a standalone paragraph, and that's paragraph 38. In terms of what Platform 2 on NCDs is focused on, and that's the reduce of salt and sugar, the elimination of artificial trans fats and antibiotics in food, the reformulation of products to enable a healthier diet, the reduction of tobacco use and the harmful use of alcohol, restrictions on the marketing of unhealthy foods and beverages to children, and also a reduction in the prevalence of physical inactivity. Next slide, please. Okay, I'm going to go over this slide very quickly. WHO is estimating that the net investment needed over the 5-year period of the GPW 13 for the base segment of the budget will be $10.8 billion US. And this also figures in a new, or it figures in savings from a newly set 5% efficiency and economy saving target. The additional investments that are needed, or there are additional investments that are needed to strengthen country capacity and normative function, and the total additional investments needed over this 5-year period amount to $2,485 million US for these areas. And the bulk of this additional investment, though, comes from the country component. And it will be very interesting to hear member state positions next week on this budget estimate, in particular this point on additional country-focused investments. And so the program budget for 2021 is is beginning now and will be discussed throughout the year and early next year at the regional committee meetings, at the 2019 Executive Board session, and also at the World Health Assembly in May 2019. Next slide, please. Our GPW 13 related advocacy priorities are focused around, for one, commending WHO for the inclusion of NCDs as one of the platforms under the third strategic priority. It's important to highlight how important this is and how positively we see this. However, our second priority will be to ensure that we get strong indicators under universal health coverage to ensure that NCD treatment is addressed adequately in the general program of work. We also want to see a targeted indicator within the impact framework on both palliative care and physical activity, and obviously need to see how the updated impact framework looks like to see how hard we have to push on these points. And then finally, very importantly, is really this point on ensuring adequate funding across all program areas. We've seen that WHO's work on NCDs has consistently been the main chronically underfunded program area. And I think there's very strong advocacy needed, especially given the current financial estimates that NCDs will not fall short again, both at headquarters and in the normative work, but also with this new focus on country level action. Next slide, please. Moving on to the report on NCDs 3.8. The report is entitled Preparations for the 2018 UN High-Level Meeting on NCDs, and starts off with an overview of the state of the response. And its main message here really is that the world has or is reaching an inflection point, and that if significant investments are not made now, the increase in premature mortality from NCDs in low-income and lower-middle-income countries will not be offset by any gains due to the progress in implementing commitments at a later stage, and that we will not reach the 2030 SDG target on NCDs. The main barriers to implementation of best buys and other recommended interventions for NCD prevention and control are framed as follows. So the first one is really honing in on what is called political choices, pointing out the very weak political action by heads of state and heads of government to integrate NCD prevention into especially national responses to the Sustainable Development Goals. The second one is around health systems, lack of access to affordable, safe, effective, good quality essential medicines and vaccines, lagging integration of the best buys on treatment into national universal health coverage schemes, etc. The third point is around national capacity, pointing out that there really is no policy backbone in a lot of countries, specifically low-income and lower-middle-income countries, and very little advanced technical expertise to implement NCD responses. Fourth one is around international finance. This point speaks to the lack of alignment between international development cooperation and national NCD responses, despite the demand from countries, but it also speaks to the struggle that WHO is facing in terms of actually fulfilling demands for technical cooperation from low and middle income countries to support the national NCD efforts. The fourth one, and I think this one or the fifth one is a point that WHO has received a lot of pushback on, and that's a very vocal statement on industry interference. And it's quite interesting because it speaks not only to interference from multinationals, but it also speaks to the role of countries, in particular high-income countries, in protecting and promoting commercial interests which is resulting in a very slow or absence of implementation of NCD best buys. If you haven't read the report, I really encourage you to read up on this section. Next slide, please. In terms of the way forward, WHO says it will continue to support member states in attaining SDG target 3.4, focusing on the NCD targets that are outlined within the new general program of work. It encourages member states to discuss transparently how to remedy the shortfall in international financial support on NCDs. And it also makes the suggestion of exploring the allocation of a percentage of tax revenue from multinationals based in high-income countries from the sales of unhealthy commodities in low and middle-income countries, and dedicating that percentage to official development assistance for NCDs. I understand that when this point was mentioned to, for example, the German government, WHO received 2 million more in contribution. So hopefully this suggestion will go somewhere. Importantly, though, and I find this very interesting, the report warns that there is a risk that the consultations on the outcome document for the third high-level meeting will default to a scenario that is the same as or worse than the current situation. So this is a clear warning to member states, but also to civil society, that a lot has to happen in terms of pushing for consensus with member states on what the commitments for the outcome document should be. And it's also an indication of the strong lobbying, the strong pushback that's already going on behind the scenes against very robust commitments. This shouldn't be depressing, but it really should be a wake-up call for all of us to be very clear in terms of what we're expecting from member states and call for a very transparent process. The report also speaks to the preparatory process for the UN high-level meeting. I'm not going to go into any detail here, as it largely overlaps with some of the points Priya has already covered. And then in the annexes of the report, you'll find progress reports on implementing the Global Action Plan for NCDs, the work plan of the Global Coordination Mechanism, cancer resolution, and also a progress report on the UN Interagency Task Force on NCDs. An additional report that's relevant for NCDs is the report on the evaluation of the Global Coordination Mechanism for NCDs, and you'll find it together with all the other Executive Board documents on the Executive Board website. Next slide, please. Our advocacy at the WHO Executive Board is certainly applauding WHO for a very straightforward report on NCDs, in particular highlighting the weak political action by heads of state and heads of governments, the chronic lack of NCD investment, and then also this point around industry interference and the role of member states themselves in protecting those protecting commercial interests. Next slide, please. It may seem tedious to repeat these points, but pushing for our priorities for the modalities of the UN high-level meeting is incredibly important. I know that many of us who've been with us in these webinars have heard these priorities many times, but if you're in Geneva next week or liaising with your governments, I encourage you very strongly to keep repeating these points, as these are still very much up in the air. I'm not going to go through all of them now because Priya already covered them, and I'll let you come back to the slides as well at a later stage. Also, just to say that, as Priya mentioned, we will launch our official campaign priorities, so the actual asks for the high-level meeting next week, so watch out for that. You may have seen and fed back on our discussion paper, but we've revised this discussion paper and are currently finalizing our priorities, and we'll be launching them publicly next week. Next slide, please. Moving on to the report on health, environment, and climate change. The report that has been presented to the Executive Board notes that avoidable environmental risk factors cause at least 13 million deaths every year, which translates to 1/4 of the global burden of disease. 6.5 million deaths are from air pollution alone, which is in the same range as those from tobacco. Global health and welfare losses from air pollution in 2013 totaled $5,110 billion, which is 7% of the world's GDP. In terms of solutions, the report recommends that taxing polluting fuels with more than half the number of premature deaths due to air pollution result in a 20% reduction in greenhouse gas emissions and generate $3,000 billion in tax revenues every year. This is more than 50% of government health spending globally. The report highlights the leadership role for WHO at the global level and health ministries at the national level to coordinating multi-sectoral responses. And it focuses on climate change in small island development states, which reflects also the focus on on environment and climate change in the general program of work. Next slide, please. The board is invited to consider a decision which invites the Director General to develop a draft action plan for the platform within the GPW to address the health effects of climate change in SIDS and vulnerable settings, and also to develop a draft comprehensive global strategy on health, environment, and climate change. And this will be considered by the World Health Assembly next year in 2019. Finally, regional committees are encouraged to provide input on these developments. Next slide, please. Rather timely in the lead up to the third UN high-level meeting on NCDs, and encouraged by member states of the Southeast Asia region, in particular Thailand, WHO has developed a draft global action plan on physical activity, which will run from 2018 to 2030. This plan recommends 20 policy actions across 4 strategic objectives to address the multiple cultural, environmental, and individual determinants of inactivity by engaging with other sectors for joint action. The strategic objectives are to create an active society through social norms and attitudes, create active environments, spaces and places, create active people through programs and opportunities, and to create active systems, looking at governance and policy enablers. It aims to increase overall levels of physical activity and to reduce disparities in participation through inclusive solutions. It has a very ambitious goal, which is a 15% relative reduction in the global prevalence of physical inactivity in adults and adolescents by 2030, which, as you know, represents an increase from the 10% reduction target in the global monitoring framework for NCDs. Next slide, please. The report on the global strategy for women's, children's, and adolescents' health this year is focused on early childhood development. Each year, the report on the global strategy has a different focus area. And recognizing that early childhood development lays the foundation for good health and well-being throughout the life course, including for prevention of NCDs later in life, this report is seeking to expand collaboration and focus on this important topic. it states that most formative experiences of newborns and young children come from nurturing care, which is defined as the provision of a stable environment that promotes health and optimal nutrition, protects children from threats, and provides opportunities for early learning through affectionate interactions and relationships. And WHO, UNICEF, PMNC, and the Action Network for Early Childhood Development are currently developing a nurturing care framework. There will be public consultations on the framework for 2 weeks starting next week, and then another round in March. And if this is an area where you have particular expertise or interest, I very much encourage you to participate. Please email me if you wish to receive further information on this. Next year's focus will be on midwifery. Next slide, please. There are 2 reports dedicated to nutrition at the Executive Board this time around. The first one is on the implementation plan on maternal, infant, and young child nutrition, and includes a draft decision to extend to 2030 the 2025 nutrition targets of the WHA. These targets are on stunting, anemia, low birth weight, overweight and under 5, on breastfeeding, and on wasting. And it also requests the Executive Board to approve 4 remaining indicators of the Global Monitoring Framework on Maternal, Infant, and Young Child Nutrition. The additional core indicators were agreed in 2015, with the exception of these 4, and the Board is now requested to approve these 4 outstanding ones. The second report is on the approach on safeguarding against conflicts of interest in nutrition programs. This tool is aimed at government officials involved in the development, design, and implementation of public health nutrition policies and programs, and it's meant to guide their engagement with individuals and organizations through a step-by-step decision-making process. There were public consultations on the tool last year in the fall, and as the next step, the Secretariat will pilot this approach at the country level in all of the 6 WHO regions to test its applicability and practical value. And I understand there's unfortunately some pushback from the U.S. government on piloting the tool. It might call for additional consultations, and so as the NCD community, we certainly have an interest in this not happening and the tool actually going into the pilot phase so that we can move forward to the implementation phase. Next slide, please. So wrapping up, let me just quickly recap some of our advocacy messages for the Executive Board. For the general program of work, we'll call for, or we'll certainly monitor the indicators under the priority area for universal health coverage to ensure that NCD treatment is adequately covered by the draft. We will ensure the inclusion of a target indicator within the impact framework for both palliative care and physical activity, and we'll be highlighting the need for NCD investment as a key priority for financing discussions for the general program of work. With regards to the preparations for the 3rd UN high-level meeting, we encourage you all to commend WHO for the Executive Board report, reiterating the preferred modalities for the UN high-level meeting, which is at least a one-day meeting in September, participation at the head of state and heads of government level, support through a UN Civil Society Task Force, and a civil society hearing no later than June this year, and that the high-level meeting result in an outcome document with bold, time-bound commitments. Next slide, please. On the draft Global Action Plan on Physical Activity, we obviously support this draft moving forward towards adoption, and we'll also be encouraging the WHO to conduct a Move for Health themed activity on the sidelines of the 2018 World Health Assembly, as was proposed and discussed on social media by Dr. Tedros a few months ago. Our statement includes such a suggestion and commits ourselves to supporting this activity. On health, environment, and climate change, we will certainly support the development of the draft action plan for the GPW platform and also the draft comprehensive global strategy. And we'll also encourage focus on environmental risk factors of NCDs and building momentum for co-benefit solutions at the UN high-level meeting on NCDs in 2018. Next slide, please. In terms of following the WHO Executive Board, our statements will be uploaded later today, so you can read up on these different, on our priorities for the different reports that I've mentioned. Feel free to adapt and amplify any of our messaging. You can follow us on Twitter and Facebook, check the NCD Alliance website and our weekly newsletter for updates on the Executive Board both this week and next week. And if you can't attend the WHO but wish to follow particular discussions, there is, as always, a live webcast that can be accessed through the link that I've included here. Apart from that, please do connect with the NCDA team either via email or in person. We're there, several of us, and we'll be happy to connect and meet to share intelligence and coordinate on any last-minute advocacy priorities. Thank you very much. I'll pause here for any questions.
Thanks, Elena. And thank you everyone for staying with us that are still online. I appreciate we have gone quite over time on this webinar, but there was a lot to cover. Before we close, let me just follow up, Elena, on a few questions that have been asked during the presentation on the EB. Firstly, we had a question around the FCTC and tobacco control work, and in the view of NCDA, is the FCTC work separate from these global NCD processes?
Sorry, I'm not sure if I really understand the question correctly.
I mean, the question is partly because it was an oversight on our behalf that we didn't include the Conference of the Parties FCTC meeting taking place in Geneva on the first slide. So in answer to the question, we very much see tobacco control and the FCTC processes interlinking and connecting into the global NCD processes. Obviously, they've got their own different ways and intergovernmental mechanisms and processes around them. But obviously in the NCD monitoring framework and the Global Action Plan, there's obviously tobacco control is one of the key risk factors, and it includes one of our global NCD targets is around tobacco prevalence. So we see them very closely connected, and we as NCDA work very closely with the Framework Convention Alliance and other key tobacco control organisations to answer that one. We have another question from Laura at Cancer Research UK. Is there a breakdown of budget in line with strategic priorities? And this is related to the WHO General Programme of Work, Elena.
Hi, Laura. No, there isn't a breakdown yet. It's a very short, high-level document, so it doesn't really go into any of that detail. And I would anticipate that discussions on this level of detail will really only take place in the coming months and throughout the next year. So I'm not sure what will be available by the WJ, but I would assume that there would be a much more detailed and concrete breakdown of the budget by then.
Great, thanks, Elena. And we had a final question which perhaps more relates to Priya's presentation, if you're still there, Priya. What's the process of getting involved with the UN Civil Society Task Force for the high-level meeting?
Sure. So the Civil Society Task Force is actually not yet a sure thing. That will be decided when the modalities are agreed and discussed, so February, early March. So we really won't have an answer until then, but we will share information as soon as we can.
Great. Thanks, Priya. Okay, thanks to all of our speakers, both from the NCDA team and Felicia Knoll, for all of the fantastic presentations today. Thank you for joining us. We will be uploading the slides and the recording of this webinar onto our website, as I said earlier. They will be up on the website tomorrow. And we will be having our next webinar near the end of February, where we will be updating you all on outcomes from the Executive Board and obviously updates on the high-level meeting and other key processes. Thank you very much for joining. Goodbye.